Have you ever heard of someone dying just days after losing the person they loved most? It sounds like something from a tragic novel, but medicine has been trying to explain it for decades. So, can a broken heart actually be deadly? Losing someone you love is one of the hardest experiences a person can face. The grief doesn't just affect your thoughts, it reaches deep into your body, changing the way it functions. Which raises a chilling question: can emotional pain become physically dangerous? One of the strongest pieces of evidence comes from what's known as the widowhood effect. Researchers studying elderly couples discovered something remarkable. After the death of a spouse, the surviving partner's risk of dying can rise by as much as 90% during the following 3 months. That's why so many lifelong couples pass away only months, weeks, or even days apart. But why does this happen? Scientists believe several factors may be working together. One study found that people experiencing severe grief and depression often have higher levels of inflammatory proteins in their blood. Those changes may weaken the immune system, making the body more vulnerable to illness. Grief can also make everyday life much harder. Without the support of a lifelong partner, simple things, taking medication, eating properly, staying active, or keeping medical appointments, can suddenly become overwhelming. And the longer stress continues, the more it disrupts hormone levels, digestion, and the immune system itself. All of these effects can shorten a person's life. But sometimes, intense emotions do something even more immediate. There's a condition called Takotsubo Cardiomyopathy, better known as broken heart syndrome. Japanese doctors first identified it in 1990. They named it after a traditional octopus trap because the heart temporarily changes into a similar shape. Inside the heart, the left ventricle, one of its 4 chambers, begins filling with blood and balloons outward. The result is that distinctive shape doctors recognize on medical scans. Most people recover within a few weeks, but for around 5% of patients, the condition can trigger a life-threatening cardiac arrest. So what causes it? Researchers are still searching for the full answer. But one thing keeps appearing in case after case: it often follows an overwhelming emotional event. Surprisingly, it isn't limited to grief. Some people have developed broken heart syndrome after moments of extreme happiness. That suggests the trigger isn't whether the emotion is positive or negative, it's just how powerful it is. When emotions become intense enough, the body releases a surge of 2 hormones, epinephrine, better known as adrenaline, and norepinephrine. These hormones target beta-adrenergic receptors, which are especially concentrated in the heart's left ventricle. Scientists believe that during Takotsubo cardiomyopathy, this sudden flood of hormones forces the ventricle to contract rapidly over and over again. Within minutes, the muscle becomes exhausted. As it weakens, it can no longer pump blood efficiently. Blood begins collecting inside the chamber instead of moving through the body as it should. At the same time, those same hormones may cause the blood vessels feeding the heart muscle to spasm. So even though the heart is full of blood, the muscle itself may not receive enough oxygen and nutrients to work properly. The symptoms can be frightening. People often experience crushing chest pain and severe shortness of breath, almost identical to a heart attack. The difference is that, unlike a heart attack, the arteries usually aren't blocked. Because the symptoms are so similar, doctors can easily mistake broken heart syndrome for more common heart conditions. Fortunately, the emergency treatment begins much the same way. Doctors may use blood thinners to reduce the risk of clotting and prescribe beta blockers to ease the heart's workload. Some patients also continue taking blood pressure medication or blood thinners to help protect their heart over time. Even so, there still isn't a treatment designed specifically for Takotsubo cardiomyopathy. Doctors also can't predict exactly who will experience it. The group most often affected is postmenopausal women. One possible reason is that estrogen appears to help protect the cardiovascular system, and its levels naturally decline after menopause. Still, powerful emotions don't discriminate. Anyone can experience overwhelming grief, fear, shock, or even joy. The encouraging news is that most people with broken heart syndrome recover completely. Our emotions can shake the body in ways that seem almost unbelievable. Yet the human body is remarkably resilient. Just like a broken bone, a broken heart doesn't stay broken forever. Given enough time, and the right care, it can heal.